This is therefore clearly a very functional task. Putting objects at different heights is part of daily life. The point is to always work on the quality of the movement, the fact that the patient practices making the movements, which are task-oriented. It's a goal itself and an important aspect. Movement, day-to-day activity, emphasizing, reinforcing the activity and the movement is a factor that is commonly taken as a positive sign. What we would like to insist on and focus attention on in relation to the therapist's role is paying more attention to the manner in which the movement is completed. Therefore, we must pay attention to the quality of the movement, observation, correct positioning, and the scapula in relation to the chest, the movement, the correct movement of the scapula, correct stabilization of the trunk, or the task of extending the trunk. Therefore, everything depends on the skills of the therapist, who can observe and evaluate, and, knowing the patient's limits and possibilities, and the limits and possibilities of the patient's anatomical structures, can take the patient to a higher level of functional integration, to a higher quality of movement. In this case, for movements that involve a task up to a certain height, we do not take the fact that the trunk can act within the movement into consideration. The trunk must act as a stabilizing element. Therefore, as soon as the patient takes a compensatory action while making this movement on the sagittal plane, we have identified their problem, which is not being able to stabilize the trunk and not managing to use the joint in an adequate manner.